Hi everyone, I'm Callum James and welcome back to Performance Healthcare Radio. And running's been a hot topic recently with lots of different events from marathons and 10Ks taking place that it's only natural that running related injuries would also increase. Today I want to discuss with you one of the most common of these injuries, which is iliotibial band syndrome or runner's knee. Now a few of these injuries fall under the umbrella term runner's knee, but we're going to cover ITBS today. Many still struggle with this injury, but there are a few key takeaways that you can implement to help you recover faster and continue smashing PBs. Bodies require more care and consideration as we age, particularly when engaging in physically demanding activities like running. ITBS is a common issue that runners encounter. Common consensus would suggest that ITBS occurs when the iliotibial band rubs against the iliotibial bursa, which then causes irritation. The iliotibial band is a tendon of the tensor fasciolatum muscle that serves as a common tendon for the gluteus maximus and TFL muscles. And it transmits their contractile forces. So when they contract, it basically puts the force through to various parts of the distal femur, patella, the joint capsule of the knee, and the tibia. So essentially, it really affects the knee where it attaches. However, when we look at the anatomy, we can see that the ITB also has tendon components for the glute medius and the bicep femoris, which is one of your hamstrings, and also the vastus lateralis, which is the outer quadricep muscle. And they all kind of blend in. And then the ITB serves as this one big thick tendon for all of those and helps transmit the forces of those muscles through the knee for whatever task it is that you're asking of it. And due to compression at the against the lower end of the thigh, or your lower end of your femur, this iliotibial bursa is thought to become swollen and leads to friction, inflammation, and pain. And it's a frequent injury caused by repeatedly bending the knee during running, hiking, walking long distances. So basically, it can be an overuse injury, but is typically caused by that sort of compressive force whenever you're putting your foot down onto the floor and exhibiting that and using that force to push yourself forwards. Recreational running's become increasingly popular since the 1970s, mainly because it's been proven time and time again how much of a positive impact it can have on your health. It's relatively inexpensive, so long as you're not buying sort of like the latest gear, that can cost you a few £100. You don't need it, but it's why it's a widely available source of exercise. Unfortunately, running also carries a massive risk of injury, which can range from about 24 to 85%. And ITBS is the second most common cause of these of pain in runners, which accounts for about 10% of running-related injuries. And these symptoms usually occur during exercise after a certain amount of time or distance. And when we see people in clinic with iliotibial band syndrome, sometimes it can be as soon as they start running that they feel it. Sometimes it can be when they get 5-10 miles or 5-10 minutes into the run that they start to feel it. ITBS causes this sharp or like burning to the lateral side of your knee, so the outer side of your knee, known as the lateral femoral epicondyle. As I mentioned before, ITBS is believed to be caused by the friction of the IT band on the lateral femoral condyle and then irritating that iliotibial bursa when we're bending the knee. Other theories do exist, though, suggesting that it could be due to fat compression near the IT band's attachment at the knee and also inflammation of the IT band bursa. Now, the friction theory suggests that repetitive impingement at around 30 degrees of knee flexion, so 30 degrees of knee bending, leads to that inflammation and pain. Although another theory that involves the fat compression between the IT band and the femoral condyle, as I just said, also exists. But when we look into cadaver studies, the presence of that iliotibial bursa can vary quite a bit between people, which basically questions that whole theory as to why people get this iliotibial band syndrome. And some studies have even shown that the lateral femoral epicondyle, causes tendon irritation of the ITB itself rather than the bursa. And then when we look at imaging-based research, which has been shown to support this, showing that the anterior posterior, so the forwards and backwards movement of that iliotibial band, is relative to the lateral femur during knee flexion and extension. Now, the ITB is attached at the knee by these really thick fibrous strands, and it firmly attaches it, so it it's not able to do too much. It's like really thickly attached, which is thought to prevent shearing between the IT band and the bone itself, along with the bursa. But it's believed the excessive tension in the IT band can compress the underlying fat tissue or the bursa, which then ultimately causes that inflammation and pain that I spoke about. Now, when we look at this through different studies, we can see that there's edema or swelling between the IT band and that lateral femoral condyle. And it's more typically seen than pathological alterations, so actually alterations to the IT band itself, but there's no direct or robust evidence that supports that compression hypothesis. They're all just kind of theories at the minute. No one's kind of sat down and said, this is exactly why this happens. But it is still a hot topic, and it actually appears that there might not be any clear indication as to why it occurs. However, some of the theories lend plausibility on, and they're relatively linked enough that the exact cause at this point in time doesn't really matter too much. It's not too much of a cause for concern. Now, there are many different ways that we can treat a runner's knee, and some are easy to do yourself, and some may require a little bit more expert advice. But the good news is that they're generally relatively straightforward, and you don't need any fancy equipment to do it. So you don't need any shockwave therapy, don't really need any ultrasound or acupuncture, anything like that. But anyway, here's 5 things that you can do to basically start help treating this your runner's knee. The first one we're going to talk about is strengthening exercises. Now, research on strength training as a treatment for iliotibial band syndrome in runners it's quite limited, and there's not actually a lot of high quality evidence to support it. And recent studies have compared conventional ITBS rehab to other different physiotherapy techniques, focusing on strength training and stretching, but have actually found no significant difference between the two approaches. And the idea behind strengthening the hip abductor muscles is that the weakness of the glute medius can lead to an increased tensor fasciae lata activity, which makes the IT band's tension even worse. However, researchers have also found that there's no abnormal TFL activation in iliotibial band syndrome patients during running. But they did observe reduced fatigue resistance in the glute medius, which is the glutes on the side of your pelvis, not your big glute at the back. Now, to address the glute med fatigue resistance, more than heavy and slow strength training exercises may be needed. Just building maximum strength may not actually fix abnormal running mechanics that could be a cause of this of iliotibial band syndrome. But targeting the glute med alone is also quite tricky because hip abductor strength training can affect the TFL, it can affect the gluteus maximus, so your big glute muscle, and also increases forces on that ITB, which then can cause more irritation. Although strength training may increase that tendon stiffness, which helps prevent injury, it can also limit the tendon's ability to absorb the shock and increase the risk of irritation under that ITB if we're going to be believing in the ITBS compressive theory. And this is why focusing on things more like neuromuscular control and strength endurance rather than just maximum strength can be crucial to avoid unwanted side effects, i.e. aggravating the injury even more. While hip abductor strengthening is often included in ITBS rehab, its effectiveness is actually unclear. And the current evidence doesn't strongly support the idea of abnormal TFL activation in iliotibial band syndrome. Building hip abductor strength alone may not address the underlying issues like abnormal running mechanics or a pelvic. And moreover, strength training may have unintended consequences such as increased stiffness in the IT band and an inadvertent strengthening of other muscles. Therefore, while strong hip abductor muscles are essential for running stability, the benefits of strength training in ITBS rehab need to be carefully weighed against the potential risks and uncertainties. However, incorporating hip muscle exercises through strength training can benefit a runner's knee. However, when we focus on neuromuscular control and strength endurance, it's essential to avoid adverse side effects rather than following strength training with measures to reduce muscle tone can also prevent unwanted impacts by taking these steps. By taking these steps, runners can work towards regaining the strength and supporting their knees recovery. And the strength training is crucial for endurance athletes who suffer from a runner's knee. According to available research, adding strength training to an endurance athlete's routine can improve their running economy, their muscle power, and their overall performance. However, the effectiveness of that strength training program depends on several factors, such as the program's duration, the athlete's current strength level, and the specific exercises that are used, including their total velocity and also their loads as well. And for endurance athletes who lack strength or neuromuscular efficiency, a general maximal strength oriented program may be the most beneficial initially for enhancing their maximal force, power, and reactive strength capabilities. On the other side, endurance athletes with already high force capabilities may benefit more from specific explosive and reactive strength training to further improve their performance. So all that being said, essentially is saying that yes, there are some benefits to doing maximal strength training. However, it may not be the most beneficial for ITBS, where neuromuscular control and just general knee, not maximal strength training, but general resistance training may be more beneficial to it, to ITBS. However, on the other side of that, part of that rehabilitative program should be that we include some maximal strength training, where we are then able to get the benefits of that, such as increasing your running economy and also your reactive force output, which is only going to make your running more, like I said, you're running more efficient, but also reduce that probability of injury later down the line as well once your runner's knee has got that much better. Now, number 2 we're going to talk about is stretching and flexibility, and I've got a bit of a love-hate relationship with stretching, but some studies suggest that it actually may be quite beneficial, where the stretching can actually help reduce the stiffness and also the neuromuscular activity in the iliotibial band, in that musculotendinous unit. But the effects are usually temporary and tend to disappear within about 30 minutes. Although there's a lot more research that's actually needed to investigate the long-term effects of stretching on the ITB, it's unlikely that intermittent stretching during rehab will result in significant changes. Instead, the stretching can increase stretch tolerance with minimal reductions in muscle stiffness. And this can help to reduce muscle tone, especially after performing exercises that strengthen the hip and the thigh muscles. To achieve those long-lasting effects, it's recommended to perform sort of stretches for at least 3 minutes, which can be achieved by doing 3 sets of 1-minute stretching sessions. Now, regularly incorporating the stretching into your routine can optimize the benefits of stretching for reducing the muscle tone and your overall rehabilitation efforts. Thirdly, what we're going to talk about is something called cross-training. Now, when runners get a runner's knee, they often worry about how it will affect their fitness. It's understandable because running can be time-consuming and expensive, and going from setting personal records to being unable to run can mess with your head and motivation, causing a lot of people to actually just give up. But being injured can also have its advantages. Now, when you train for a competition, you can get tunnel vision and focus solely on the running, which harms your overall athletic development. Now, taking a break can allow you to step back and work on other areas of improvement. So, for example, if your runner's knee or your iliotibial band syndrome is that bad, you may have to stop running temporarily. We'll never try to push you towards stopping running. We always try and reduce it and then try and keep you running. But there are in some sort of extreme cases where you will have to stop running completely just to try and help, just let it to settle down and recover. But it does lend that time to then focus on other improvements. So, for example, running can be quite tough on your knees and joints, even though it's actually beneficial for it. Can actually cause a lot of fatigue, and then that constant impact can also cause you to overload these joints, which then can obviously lead to injuries later down the line. But there are alternatives that you can use, like running and like cycling and swimming, and that can help you maintain or even build on that aerobic capacity whilst your knee is recovering. So you can still train in your zone 2, zone 3, even zone 1 work, and still get that benefit of working towards your end goal of building a big aerobic base. And it's also a great time to work on areas that may have been bugging you for a while. So, for example, if you experience calf tightening when running, now's the perfect time to build that strength endurance to prevent it from happening whilst you get back to running. Or if you experience low back pain when you're running, now's a perfect time to then work on your trunk and also your back strength. And so these are showing that exercise, especially cardio, can actually boost blood flow to damaged tissues, which actually helps them heal more quickly. So by doing these things, you may actually be encouraging your ITBS to recover a bit quicker. Follow with a good nutrition plan, and then it should all help expedite that recovery. So number 4, we're going to talk about soft tissue techniques. Now, the soft tissue techniques can help you feel better and be more flexible if you're recovering from a runner's knee injury. Massages can be effective because you can customize them to your liking, essentially. So you can dictate how deep a massage goes and exactly how much pressure is used and stuff. And if there's any specific techniques that you're aware of that you want to do. However, if you're getting a massage from a massage therapist, then obviously they'll make do what's best for you. But the key is to finding a good one. So a lot of people, when they will come in with us and get, say, like a sport or a deep tissue massage, and they think that it's going to be an absolute agony, it doesn't actually have to be the case. You can do massage to a specific tolerance of that person and still get the benefits of what you want to get out of it. You don't have to have people crawling around on the bed trying to jump off because you're causing them so much pain. It doesn't have to be like that. But doing massage into the TFL, your outer quads and the glute muscles can be especially helpful for people with iliotibial band syndrome. Massages can help with that muscle tension and increase the blood flow and overall muscle function. And if you want to get the most out of your recovery, you should also warm up before you're doing the exercises and cool down afterwards. Do some strength training for your lower body to make sure that you're getting enough rest. But by taking that holistic approach to the recovery, you'll be able to get back to your old self much, much quicker. And finally, and probably the most important, is a gradual return to running and load monitoring. Now, once your ITBS pain starts to fade and you've been working on building up muscles around your knee, you've been recovering, getting massages, doing all of this, it's time to start then running, getting back into the routine and building that running routine. Obviously, having to take our time with it. You don't want to go back in and then, say, if you've been out for, 6 weeks or whatever, and then you go back to fucking trying to run a 10K, that's just not going to work. So you need to begin with short, easy runs, and then typically on a flat terrain as well. Now, if you're working with a rehab expert who, is used to taking athletes from that point of being in pain to getting back into performance, like ourselves, then we will take you through a series of a battery of tests to make sure that you're capable of withstanding that tolerance to run if your ITBS is that bad. If it's not that bad, we may even say, right, we just need to manage the amount of running that you're doing and then build around that, which is actually our end goal. The whole point of rehabilitation for us is to keep you exercising whilst in the presence of pain or an injury, and keep you pushing towards the goals that you're trying to achieve. But what we would typically do is begin with easy runs on as flat a terrain as we can, and then gradually increase that over time, and basically building the intensity as your knee will let you. We'll be paying close attention to how your body feels during this phase to make sure we're not pushing it too far or anything. So if you do feel any pain when you're doing this, typically what we'll say to people is that anything above what you perceive as a 4 out of 10, where 10 is the worst pain you can ever imagine, that's where we need to kind of stop, readdress, or just kind of see what's going on, because something may have been missed, or maybe we've just pushed you a little bit too far too soon, so we just need to reevaluate where we're actually at. If you try to push through that pain, you could end up making your injury worse and then delaying that healing time, and so it might set you back even a couple of weeks. Feeling that little bit of discomfort is actually all right, but you don't want to try and do too much too early on. Instead, take it easy and then be mindful. Let your body adjust slowly to running again. Remember, the goal isn't to return to your old running routine as fast as possible, but to build up your strength and resilience while minimizing the risk of further injury before we get you back into, beating your pre-injury levels of running, which is always our goal. But by paying attention to your body and gradually increasing that running workload, you can get back to running safely and sustainably. So make sure that you're always listening to your body and gradually ramp up your running, and you'll get back to your usual routine in no time, so long as you pay attention to it. So to basically summarize all of that, so runner's knee, the runner's knee that we've been talking about is iliotibial band syndrome, and it's a really common running injury that requires really effective management. It's one of those injuries that doesn't seem to go unless it's treated properly. So to address the condition, you should be adopting a comprehensive strategy that includes understanding treatment and also prevention measures. And that can involve strengthening exercises, stretching, cross-training, and then soft tissue techniques, and then a gradual return to loading, all whilst carefully monitoring the amount of load that is going through your body. And it's crucial to understand that each treatment method has its nuances. Although specific approaches such as strength training and stretching offer benefits, that effectiveness may vary depending on individual factors such as your ITBS severity, the equipment that you've got available to you, and other things along those lines. So it's always important to make sure we take a holistic approach, a combined various strategies that is going to yield the most significant results in managing a runner's knee or the iliotibial band syndrome and preventing it from occurring later on down the line. And it's essential to prioritize your musculoskeletal health, whether you're a seasoned runner or new to the sport. But by proactively addressing issues such as runner's knee and adopting comprehensive rehabilitation and injury prevention strategies, you can overcome current challenges and lay a strong foundation for long-term running success. Now, that's the end of what I've got to say, but I'm now going to end the episode with a bit of a shameless plug. So if you are struggling with the runner's knee or are looking to enhance your running performance while reducing the risk of injury, then we're here to help. You can book in an in-person or virtual assessment with us, and together we can create a customized plan that caters to your specific needs. It helps you to overcome obstacles and enables you to accomplish new PBs and become better than you ever thought possible. So if you have a runner's knee right now or any other injury, don't let it hold you back. You can take the first step towards a robust, healthier running journey today, and check the description for links to book an appointment either virtually or in person. Well, that's all for today's episode. And take care, and I'll speak to you soon.